Hi guys, it's Ekansh. We're back again with another video today, and today we're covering another topic which is a crowd favorite. Used to be my favorite as well at one time, and I have with me a very old dear friend, Devanshu. He is one of those very few people who has successfully transitioned from a career in medicine and into the corporate world. And today he's going to take us through his journey, what made him get into medicine, get out of it, and how he's finding it. Without further ado, Devanshu, tell us a little bit about yourself and a
Sure.
bit about your journey as well.
Yeah, definitely. So first of all, I would like to thank Ekansh for inviting me. It's a pleasure here to speak about my journey and share insights from my experience with viewers of this channel. So,
Thank you.
guys, I'm Devanshu Arora. I'm a medical doctor, a trained ophthalmologist, and an international MBA graduate from one of the top business schools in the world. My medical journey started when I started my MBBS. I did from SGRR Medical College in Dehradun, and then went on to do my diploma in ophthalmic medicine and surgery from Jawaharlal Nehru Medical College, part of Yale University in Belgaum, Karnataka. And beyond that, then I did my general ophthalmology fellowship in Bangalore from Lions Eye Hospital for a year. After that, I got a good opportunity to be a clinician in my initial career, and worked as an ophthalmologist in the same hospital where I worked as an ophthalmologist. I got the opportunity to actually get into the business side of healthcare also. So I got a lot of hands-on experience on management, where got a lot of roles in improving the hospital operations on the patient experience, as well as the business side of like how to increase the business. So was part of all those discussions. From quite early on in my medical career, I was always interested in the business side of healthcare. So always had that inclination that going forward, I would like to venture out into this space more. But I'll share my journey that I was initially a little reluctant because coming from a hardcore medical background, it seemed like a far-fetched dream to be able to become a kind of a do MBA or maybe switch to the business side. So I thought that may be a totally different game, and we may not be I may not have that relevant experience previously, not the training, and I'm not sure how far I'll be able to get into this side. But I always had that motivation and started exploring these opportunities furthermore, and started speaking to a lot of other people who were in the business field, people from different backgrounds who had switched to the business side or the management side, or were working in corporates.
So
And
when did you start your networking, Devanshu? I mean, as
yeah.
you always had a interest
Mm-hmm.
in management, but you
Yes.
saw through your medicine career,
Mm-hmm.
practicing. What was the besides having that inclination that you always had? What made you
Mm-hmm.
finally take that leap of faith to make that
Yeah.
into management?
Yes. So working during my post graduation, I was like quite interested in the business side. I was always, when I was working in my fellowship also, I used to speak to people from the management side in the hospitals. And especially in Bangalore, we have a lot of corporate hospitals here. So when I was working in Narayana Valley, I got to meet a few of the managers in the management side of the hospital, and got insights about how this space is. Apart from that, my own, I had been always searching from that time onwards, like how to, what are the opportunities, how to take this leap into going to the business side, and start exploring a lot. My real, I mean, journey started of preparation, and like finally deciding to definitely go for a MBA from a good university started when I started speaking to some alumni from some of the business schools, which are well-known business schools, and luckily I had them in my circle, so I started speaking to them. And my perspective opened to this when all of them said being from a doctor, being from the healthcare industry puts you at an edge into these programs if you're well prepared, because they value diversity a lot, and most of the people coming for the MBA are usually from a corporate background or a business background, or probably engineering or technology background. So
So you're saying
there's a
that
need.
being from a healthcare background is actually beneficial. Uh,
Of course, yeah, that was quite interesting and like a new insight for me as well at that time. And I would like to share with the viewers here as well that being a doctor or having experience in the healthcare industry, working for years in healthcare industry, puts you definitely at a advantage as compared to the kind of opportunity, like your chances of getting into a good business school, because most of the world known best business schools are actually working on healthcare quite proactively, because we see that there's a projection that healthcare industry is going to is the next industry which is going to really boom a lot. And this COVID pandemic has even proved that even further with the help of technology. There is definitely going to be a lot of progress in the healthcare industry, and as a business, it's going to definitely, like a business field, it's going to grow a lot, and there are going to be a huge business opportunities here for companies as well as for individuals. And seeing that, they definitely want people from healthcare industry to come to the MBA program. It adds to their diversity in the MBA program for most of the universities. And MBA programs are meant for people from different industries to come together and share their experiences, share learnings from each other's industries, which can be applied to people, to the different sectors. And that is how they really value this. So my eyes opened to that, and I saw that there is a possibility for being able to do an MBA from a good business school. So initially I was looking for Indian opportunities in the Indian business schools, but then I shift my focus entirely to international applications and international business schools, and starting the process to actually start
the process. Devanshu, besides you mentioned working as one of the first things that you did, and obviously it forms a key aspect in making any decisions nowadays. Besides network, could you tell us maybe 2 or 3 things that you would like to, or maybe tell yourself going back, that would really help someone make the transition? Because a lot of people have, but they often lack the means. So one, networking. What are the other 2 or 3 traits that?
The second is to actually take a good quality work experience, because most of the business schools actually appreciate and require you to have a good amount of business, a good amount of work experience. Actually, it may be in any field, maybe in a medical field, or it may be in some form of management field.
So do they recognize your postgrad as work experience?
Yes.
Are they looking for people post MBBS or post MD/MS? What is preferable?
Yeah, so if you're aiming for an international university, then post MBBS you need definitely more work experience to be able to put yourself as a good candidate to be able to apply in good universities. So the post graduation is considered as a work experience, because we are working full time in the hospitals, and obviously we're learning, but it's a full time work, as we have all experienced. And so that is definitely considered as a work experience. And for me also, when I was applying, I had worked in my postgraduate course and for 2 years, and then I've done my fellowship. So all that was counted as work experience. And when I was working in the eye hospital, which I mentioned, so that was also counted as an experience. So I had almost 5 years of experience on my application.
Does the branch of subspecialty make a difference? Say, for example, you are specialized in ophthalmology. Say someone with a medicine background, or a pediatrician, or an ENT.
For getting into an MBA program, it does not matter much, because it's the kind of work experience which you portray on your application, and the kind of learnings you have had, the skills you have developed over time, which matter more than the specialty which you are working into. But for your own career prospects, I would say if you're not focused onto one specialty, and you are still at your completed your MBBS and now figuring out how to go next, doing selecting fields which are more towards medicine, like internal medicine, or in general, which give you a general health approach, would rather be more more valuable going ahead if you are looking to careers in different healthcare companies and all. So yeah, for me, then the ophthalmology experience does not really come into much picture now that I'm working now in the current scenario where I'm working, or what are the things which I'm trying to do. So yeah, it's a personal preference, I guess. If you're interested in specialty, definitely you should go for it, and maybe then take some experience and then go for an MBA. If not, and if you are open to opportunities, I would recommend going for general medicine, or if you are interested in some special branch like psychiatry, so mental health companies are also coming up, or specifically in women's health, if you're going for gynecology, that could add up to your value. So more of mainstream fields, I would say, would be a preference. Yeah.
So say networking one, the second, as you said, having some
work experience.
Yes. Tell me one more that viewers should keep in mind.
Yeah. Third is, I think, brushing up your personality. Like you have to gain a lot of confidence, and you have to gear up for like being at par with people who are already in the corporate world.
Mm-hmm.
So you have to, like, for me also, I underwent a lot of transformation myself, like personal growth, I would say, where I started improving my communication skills, my confidence, and my body language. All those things come into play because you have to apply, then you have to give interviews in a lot of universities. Then when you are there in the program itself, you are expected to be very engaging with the class, with the people around you, with and do a lot of presentations. So I think we get a fair amount of experience of that in our medical school. But apart from that, you have to yourself, like, try and be into such experiences where you brush up your personality. I think these three things are the key to being a good candidate for this MBA program. Yeah.
That's very helpful. So keeping this in mind,
Yeah.
this, what were the exams or what were they had to do
Yeah.
to get into it?
I'll walk you through basically the procedure of like how to plan up for an MBA if you're thinking to go for an MBA from an international university. So I would say, like, start planning at least 2 years before the time you want to go for an MBA. That would be ideal because yeah. So once you start speaking to people, you start planning how to prepare. It will take you around 3 to 4 months to get into the understanding of the process. And then the first step is to actually get clear, give the GMAT exam or the GRE exam. GMAT is specifically for medical management schools, so for MBA. GRE is for general management programs, but most general master's programs. But most universities accept either of the scores. So if you're specifically focusing for MBA, I would suggest to go for GMAT. So GMAT requires around 6 months, I would say, of a part-time preparation, and then around a month or so, or like 3 to 4 weeks for a dedicated full-time like a brush up before the exam, so that you give a good shot. And it might be that if your first attempt does not go well, you might require to, like, take it again if you want to improve your scores. So
what's the kind of score that you're looking at to get into MBA school?
So the GMAT is a total of 800 scores, and most people would like aim for a 780. Obviously, it's very high, but being from a medical background, I guess since we have some edge on our applications with our healthcare background, everything, even if you are managed to get above 750, you are very well placed for some of the top universities in the world. And even like there's no minimum, but it's all depends on your application. So GMAT is just one part of the equation, and the rest is your application. So even if you have a lesser GMAT score, you can still apply and try your chances, and there are definitely chances that some of the universities.
It's not a make or break.
It's not it's not a make or break. Even people with 680 scores, 650 scores have also gone on to some good of MBA schools. So there's always a chance. Don't get disheartened if GMAT does not work out much for you. But yeah, you should aim high, obviously. And the second part of the equation is to actually prepare a very well application, like work very well on your application to the business schools. Each business school each year releases some questions which you are required to like answer in your application. They're usually either you can write them in an essay format, and usually you have to write some essays, either 2 or 3 essays. Or now they have like given you an option. Most of those business schools give you an option to actually create a video instead of like writing down an essay. You can actually speak it out and speak your thoughts and project yourself to be a candidate for their.
So instead of essays, you're actually allowed to make a video.
So it's like most schools give you an option, either give a written essay or send in a video essay actually.
So do you do a reel now? That's the new thing, right?
Yeah, you can showcase if you're a content creator, then obviously you can showcase all your work while your application. And they most of the schools value this different kind of experiences or different kind of ways of like telling about yourself. So that is one. And then you start applying, and if you will definitely get some interview calls from some of the schools which shortlist you, and then prepare for interviews, give interviews. There are usually 1 or 2 rounds of interviews which you have to go through to get an offer. And yeah, so that is one. And I mean, I'll just add one last point here is that since the tuition fee is usually very high for most of these MBA programs, you can also think of applying for scholarships if that's possible, if you get one. If not, then If you can sponsor it yourself, then fine. But if not, then most people go for a student loan. And it's some people think it's quite risky, it's quite expensive. How are we going to manage this? But I would suggest that more people to think about, even if your finances don't allow, to think about an MBA if you're interested from a good university. Because frankly speaking, if you get a good job after your MBA, then you're mostly able to recover the cost of the MBA within 1 year or 1.5 years, and you're able to repay your loan quickly. So I would not I would suggest people not to hesitate from taking student loans and going for MBA programs. MBA programs in Europe are usually 1 year long, and MBA programs in the US are mostly 2 years long. So it's just a matter of choice, and you can explore your options and then think what works out for you.
Absolutely. So, I mean, that's very helpful. Thanks. Because now you kind of understand better on how it's easy to have a dream, but it's very important to break it down into steps. We'll go into the depth of what the MBA actually holds in this video. We'll save that for the next video that we plan. Before we finish for today, I'd like to ask a question. What was the biggest challenge, or what are the top few challenges you faced? And what were the pros and cons that you've felt the choice that you have?
Yeah, so it's a big decision to actually, like, for me, like, I left my clinical work around behind, and clinical, I've stopped being a clinician. I transitioned into totally being a business person. So it's a major decision. I think there are always you're always sometimes thinking whether is it the right thing for you, or like there's no turning back sometimes, because you're going to miss sometimes your clinical experiences with patients and all. But then it depends on what your real motivation is, or what real interest lies in. I would say the most challenging part is actually is the application process. Obviously, it's very tough. So it's a long process. You have to be prepared for that. And then depending on where you're going, you're basically the second most challenging part is the journey itself, because we as like people from medical field have not been exposed to this area at all. There's not even a slightest touch of business anywhere in our education or in our like experiences. And here you are sitting with people who are from the corporates, who are used to those nomenclatures, who are used to that those kind of dialogues which you have to quickly learn and adapt to. So I think you have to be very adaptive and very quick learner to be able to like modify yourself to fall into that place. Some people I've seen, I'm not seeing people from medical field like failing here, but some people from some sectors definitely have a hard time like gelling into the MBA program. So that is one challenge. I think, I mean, it's your preparation, which is the most important part here. And if your preparation is fine, if you already know the things which are coming up, what is in an MBA program, what is the experience going to be like, then you're more like prepared for that transition. And you have to be very quickly, you have to very quickly transition, and you have to be very fast to modify yourself. If you're not, then you stay behind, like you get left behind a little bit. So I mean, those are the kind of challenges which look forward to, but at the same time it's like very exciting with the challenges itself. MBA is a very challenging program if you're doing from a good place, and at the same time it's very exciting, as I said. So you have to focus on the excitement part and like enjoy it the full, and gain the maximum from it, and then try to form your career into a different field which you want to get into.
Last question, yes or no question.
Yeah.
Happy with the decision you've made? Yes or no?
Very happy. Totally satisfied.
All right, super. That's been very helpful, Devanshu. So you've covered actually really helps on who should look for it, what kind of preparation, what kind of timeline one should expect, what are the things that they need to do, what are the things one needs to focus on. We won't go into the depth of exactly what the MBA program entails, and also the future prospects. We will discuss both of these things in the next. Guys, if you like this video, share, subscribe. I'd also like to thank Devanshu so much for taking the time out and sharing his experience with us. He forgot to mention, or maybe he was too humble to mention, he's transitioned post his MBA into a very, very successful startup, and also venturing towards hospital management. I wish him all the luck from all of us, and I'm sure from all of us as well. If you have any questions, if you have any queries, feel free to drop them below or email us at yourmentor121@gmail.com. You can also find us on our website, doctorsinuk.co.in, or on Facebook, or leave a comment on YouTube, anywhere you find easy and comfortable, and one of us will get back to you as soon as possible. Devanshu, thank you so much. It's been an absolute pleasure.
Thank you.
Until the next video, we will talk more.
Definitely. We have more to talk about. Definitely. In the next video, we'll definitely cover all these topics, and it's been great to talk here with you. I mean, and let's look forward to more. Yeah. Thank you so much.
Thank you, guys. Thank you.